Paperwork. As with most aspects of healthcare, there is certain documentation that needs to be completed. We are accredited by ACHC, which is similar to the Joint Commission, and some of the paperwork is needed to comply with their standards. We have tried to minimize the amount of paperwork as we are aware that most agencies have plenty of their own to complete. I will briefly explain the purpose of the forms to assist you with the admission process. The patient will receive a blue folder, orange for nutrition patients and red for heart failure patients, which contains patient instruction booklets, medication sheets, patient therapy-specific instructions, and financial agreement. The financial agreement needs to be signed by the patient or responsible party, and the designated copies returned to CarePro Home Infusion in the prepaid envelope. In most cases, a care facility patient will not have a financial agreement to sign. A yellow clasp envelope for the agency or facility nurse is included with the admission packet. It contains 2 forms that require patient signatures, as well as patient therapy-specific instructions, medication information sheets, flow sheets as applicable, and a copy of the pharmacy work order. The pathway signature sheet is a document that lists the teaching information provided to the patient and contains a statement that confirms that the patient or caregiver is independent with the IV or enteral procedures. It requires a signature to confirm the receipt of the information, as well as to document the independence of the patient caregiver. This generally applies only to the patient in the home care setting. The medication cover sheet lists the IV medications that CarePro Home Infusion is providing for the patient. There is also a copy of the medication information sheets for the agency or facility nurse. In the home care setting, the patient or caregiver needs to sign the cover sheet to confirm that the nurse has reviewed the IV medication information with them. If a mechanical infusion pump with alarms is used to administer the medication, there will be a pump verification form to sign and return as well. This form confirms that the nurse has verified the pump settings and has affirmed that the patient is able to hear the audible alarms. In some cases, there may be a delivery ticket that needs to be signed by the patient to verify delivery of the medications and supplies. This is usually completed when the CarePro delivery driver makes the initial delivery to the patient's home or to the hospital. There is a prepaid envelope included in the packet for return of these documents to CarePro Home Infusion. One additional sheet that may be present is a controlled substance and delivery and disposal record. This sheet is used to track the disposal of medications such as morphine and Dilaudid, which are commonly administered to hospice patients. These sheets should be returned to CarePro Home Infusion once they are completed.